There's $10 million in the budget for a new kids' eyesight initiative from Governor Mike DeWine called the Ohio Student Eye Exam, or OhioSEE. It looks to get kids who fail eye exams more care and glasses if they need them. My Statehouse News Bureau colleague Sarah Donaldson spoke to Cincinnati optometrist Dr. Terri Gossard about the vision behind the OhioSEE program.
We know that 1 out of 4 children in Ohio has an undiagnosed vision disorder. This is CDC numbers. And yet, it's a very, very small percentage of students that actually have an eye examination prior to starting school, 1 out of 8 in the state of Ohio. And even more challenging is that by the time they graduate, Ohio students, only half of them have had an eye examination. So that's an awfully long academic marathon to be running without glasses, or in this case, shoes, is how I like to think of it. So certainly Ohio has mandated vision screenings that are helpful in identifying when we have children that are at risk for having vision problems that will delay their ability to see and learn. But we know that even if we screen these children, only 30% of the screen fails actually get to a doctor to have any potential vision problem addressed. So it's a real challenge. Certainly, we've got a lot of energy and momentum in the state of Ohio around how to address that. And that's why I'm just really excited we're here to talk about it.
So I kind of want to first ask, before we get into the OhioSEE program, what should parents listen for or look for if they have a kid that they suspect has some issues with their eyes? Because it can't always be super easy to kind of say, I can't see.
Yeah, they don't know what they can't see, right? One of the most common things that I hear from patients when you put their first pair of glasses on them, if they're nearsighted, there's leaves on the trees. They didn't know that those green leafy things were supposed to have actual leaves on them. But as far as a parent and raising children, sometimes the children will tell you, but most of the time they won't. You might be lucky enough to catch some behaviors like squinting, moving closer to see things, oftentimes some uncommon head positioning or covering of one eye in order to see clearly. But the challenge is the students or the children don't always know what they're doing or know that what they're seeing isn't normal. So we really recommend, both here in Ohio and nationally, that the first eye examination by children happen within the first year of life. It's really, really important that you make sure that the eyes are developing equally so that the child can see clearly and comfortably. And then have them at an eye doctor at age 3. And then depending on what you're finding, certainly in kindergarten, and then every 1 to 2 years after that. Unless you go through the rigor of a comprehensive eye exam, there are going to be a lot of uncovered problems that need to be addressed.
There are regions of the state, I'm specifically thinking about somewhere like Southeast Ohio. It's more rural and there maybe aren't as many optometrists in the area. Are there ways that the OhioSEE program addresses this at all?
Yeah, absolutely. So whole lot of reasons with respect to access. Number one is, do we have a doctor nearby? Now, I'm happy to report that of the 88 counties, we have doctors of optometry in 87 of them. Certainly, though, just because we have them in the county doesn't mean it's easy for the child to actually get to that doctor. Does the doctor have hours that are inimitable to a single parent? Do they have the right kind of insurance coverage? Do they have spots, or are they booked out three months? So that's where the OhioSEE project is really going to be helpful. We're coming into the schools to help deliver that in conjunction with our foundation as well. So we're going to tie them to local providers. But I also want to call out, it's not just in rural areas. So I live in Cincinnati. We have the city of Cincinnati. I was shocked as I started to work in a school-based health center down here in Cincinnati, and discovering the lack of access that children that are in my neighborhood have to actually getting care. So we know that we have to address this from a lot of different avenues, and are really grateful for the energy and the attention that it's getting.
DeWine's office asked for $50 million to create OhioSEE originally, but lawmakers pared that back to $10 million.